basic foot hygiene, that's kind of where we're trying to summarize that. Obviously, proper hygiene of your feet is just as important as proper hygiene of everywhere else on your body. And I usually counsel patients and discuss what that means. And that means, take some soap and water, wash your feet every day. Just because you shower or get in the tub doesn't mean you're actually scrubbing your feet. They're just sitting there. Don't forget to reach down and scrub your feet. Cleaning between the toes. And there's a reason why that. It decreases the bacteria, decreases the amount of surface fungus that might be on your skin, and decreases the potential for developing infections like athlete's foot or fungus in the toenails if you do good, proper hygiene. Sometimes no matter how well you do it, sometimes you're still going to get those things, but that really helps. Clean socks. If you wear a lot of sandals, make sure you're spraying down your sandals and keep them clean with either Lysol or something like that to disinfect them. That helps too. And nail care is always a question. How short do I cut my toenails? Just don't cut them too short. And sometimes it takes a trip in to see me, and that's sometimes all I do is visit with somebody and say, hey, this is the proper way of taking care of your feet. This is how you take care of your toenails, because a lot of people do it wrong and they end up getting ingrown toenails or other issues. But just basic care, just good old soap and water on a daily basis, and making sure that you're not going to some place where, if you're going to get a pedicure, that you're going to go someplace where it's filthy, where they don't sterilize their instruments. Make sure they sterilize their instruments and have the proper way of doing that, and that'll prevent getting infections from going to those type of facilities. And hopefully most places are doing that. But those are the things I'd caution people on.
Okay.
Just basic, simple soap and water, making sure the facilities you go to have your toenails done or pedicures done, that they're clean and they sterilize not only their instruments that they use, but also the basins that they're soaking your feet in,
Okay.
in between visits.
Okay.